Good morning, everybody. Welcome to another session of our FGC class of 2002 blogging session. Today, we're going to be having an interview session with one of our own, and after that, we're going to have a playtime session. We're starting today with an interview session, and we have a guest on the show today. You can see him already. He is Dr. Obiajulu Kanu. But before I make him introduce himself, I just want to, read out his profile. But first of all, I'd like you to know what to expect whenever you come on such our recordings. It's going to be, it's either it's an interview session or it's a group interactive sessions, or we're having a mentoring session, an educational section, playtime, game time, or your mama section. And today we're starting with an interview session, and Dr. Obiajulu Kanu, I'm going to post his profile, share his screen of his profile, and then I'll let him introduce. Before I do that, I'm going to start by reading off his profile. Dr. Obiajulu Kanu, by the way, he's an alumni of the Federal Government Port Harcourt class of 2002 set. He is also a general and interventional nephrologist with WOW board certifications in nephrology and internal medicine. He graduated from 2010 from the University of Nigeria, and he went ahead to do his residency in the Texas Technology University Health Sciences Center, and then his fellowship in the University of North Carolina. But at this point, I'll call on Dr. Obiajulu Kanu. Dr. BJ, can we meet you, please?
Yes, of course. Hopefully, a vast majority of the FGC folks listening to this know me already. I am Obiajulu Kanu from the class of 2002. Well, thank you for that kind introduction. I wish my mom was here to listen to you say such nice things about me. But no, yes, I am a kidney specialist, which is also known as nephrology. We take care of. I finished from FGC Port Harcourt in 2002. I was a 2002 set. Went ahead to do my medical school in Nigeria, and afterwards left Nigeria to follow my medical training in the US, after which I finished through my training in internal medicine, went on to do nephrology, which is kidney specialty, and then finished as a nephrologist, did an extra training with in interventional nephrology, and then also had that additional experience in interventional nephrology. I am a general internal medicine specialist to begin with. And then on top of that, I am a kidney specialist. By virtue of my specialization, we take care of patients who have kidney disease and hypertension. And hopefully we can touch on a little bit of what I do in nephrology. But that's what I do and who I am in a nutshell.
Okay, yeah. So thank you, BJ, for that brief introduction of yourself. I had wanted to start by asking you who a nephrologist is, but I think I learned that already from you. You just said a nephrologist is a kidney doctor specialist or kidney medicine specialist.
Correct.
Okay. Yeah, cool. So your profile says you are both a general and an interventional nephrologist. So what's the distinction between both? General, interventional?
Yes, a general nephrologist. Thank you. A general nephrologist is he's got kidney specialist who takes care of people who just have kidney issues overall. That's, I guess, hence the word general. They also take care of patients who have hypertension issues, severe hypertension, difficult to control hypertension. Interventional nephrology is another subspecialty within the general nephrology space. And basically what an interventional nephrologist does is work on and manage accesses for dialysis patients. And by accesses, I mean whatever patients use as an access for dialysis, whether it's peritoneal dialysis, where they have a catheter that comes out the belly, or it's hemodialysis with blood, where they have a catheter that comes out from the neck, or some people might go ahead to have a surgical procedure called an AV, arteriovenous graft, or arteriovenous fistula. So an interventional nephrologist takes care of these accesses and manages them to make sure that they remain functional for dialysis treatments.
Okay. So thanks for that. Thanks for that clarity. I'm going to switch this time around to asking you some. You very well know this session is meant to be a prerecorded session, so that that viewers would check up, and after consuming the content, they definitely are going to have questions. So I'm just going to ask him a few of those questions. You're going to expect more questions. I hope you'll be expecting more questions after this session. And then when we have the follow-up session, it's going to be a live session where you're going to be able to answer questions from our viewers and our alumni members. Of course, anyone. This such interviews will prove resourceful and useful to any other person. But I just have to note that, please. Okay, so now, as a nephrologist, why would you say why is it important to know about kidney diseases? For a layman, why is it important?
Absolutely. So I want to start by saying that everyone has a set of two kidneys. Some people have one, some people have three. Very rarely you have three. Some people have one.
Doctor, sorry, did you say three?
Very rarely. It's a rare condition where you get three, but the vast majority of people have two. And your kidneys are those two organs that fits one on each side towards your lower back and it's about the size of size of your fist.
Yeah.
But very vital to the functioning of the entire body. So vital that 20% of what leaves the heart gets to the kidneys. 20% of that gets to the kidneys, and they play an important role. From cleaning your blood of toxins that should leave your system, to maintaining the right amount of volume, to making sure that you're not anemic, to instructing your bone marrow to produce red blood cells, to maintaining good blood pressures, to making sure that the components of the blood remain within a normal range, so that people don't go too high or too low and get very sick and affect obviously other organs in the body, including the brain and the heart. So plays a very important role. When the kidney function fails, people start to get very sick. And why it's very important to keep in mind, the possibility of kidney disease is what's happening in our world today. In the United States, the prevalence of kidney disease is about 14%. That's about 37 million United States adults with kidney disease in a developed country. And of course, 1 out of 7 adults with kidney disease. Unfortunately, 9 out of 10 of them don't know they have kidney disease. And consequently, we have over 800,000 people with kidney failure. Now, I'm talking about the late stage kidney disease where people's kidneys have failed and they need to get on dialysis. 800,000 of them. 550,000 of them on dialysis. And about 250,000 of them have a kidney transplant. They're going ahead to get a kidney transplant. Now talking about transplants, more than 90,000 people are on the kidney transplant wait list in the United States. Last year alone, only 28,000 of those people were to get a kidney. That means 75% of people on a wait list will not get a kidney at every point in time for every year you look at. So this is for a developed country like the United States. Now, think about how bad that can be in a developing country as Nigeria. Nigeria already has a prevalence of chronic kidney disease of 24%, which is almost double the prevalence in the United States, considering the population we have in Nigeria. And so it is very important for people to be mindful and also understanding that what impacts kidney function is very common in our Nigerian society. It's very common in the world, but I think it's even more common in Nigeria. And to make it to even explain how bad and how bad it is, the people, obviously with the health literacy, the health activation, the socioeconomic conditions with people in Nigeria, it is almost it makes it very difficult for people to pay attention to their health.
Okay.
And so understanding that diabetes and hypertension are the two most common causes of kidney disease, you can see how that can be a problem in Nigeria.
Okay,
most people.
You're going to explain on that. I want to put a pin on that so I could ask another question that probably would enable you to give a broader explanation to that. But just so in case, just for our viewers to take note, Kanu, he's practicing, he's a nephrologist, as he introduced himself at the beginning, and you could check him up and even request an appointment or request a session with him by visiting the website, TexasKidneyPartners.com. As you can see on the screen, the TexasKidneyPartners.com. You could visit the website, request a session with him or an appointment with him, and he practices in the United States, Texas. Make that known to our viewers today. So, Dr. BJ, while you were explaining, there was a staggering statistics that almost threw me off balance. Using the United States statistics as a case study, said about 17% of of adults in the United States have kidney challenges, and about 9 out of 10 of them seem not to be aware. So, and this is quite a precarious situation. So, I think I'd like to ask, so what are the symptoms that one should look out for in order to figure out, to tell whether or not he or she has a kidney disease?
Very good. So that's where, I have to say this. Most of the times, what causes kidney disease, whether it's diabetes or hypertension or heart disease, most of the times at the initial stages of these conditions, people don't have any symptoms, and so they don't know that they have those conditions until it starts to involve organs like the kidneys. And so when people start having kidney disease, there are several stages of kidney disease. There's the stage 1 up to stage 5. Some people may not have any symptoms until they get towards the late stages, stage 4 and stage 5. At that point, it becomes too late. And that's why people may not know. That's why symptoms may be, at the time you start having symptoms, it's too late. That's one of the reasons when you ask the question about why do we need to know about kidney disease, this is one of the reasons. It's a silent disease process, and you can go ahead and call it a silent killer, because at the time you start having symptoms, it is too late. Now, talking about symptoms, yes, there are a few symptoms. Some of them are also non-specific too. So when you have them, you may not know that you're already having them. You may not recognize them as symptoms of kidney disease. Okay. Some of them would include leg swelling, leg and facial swelling, frothy urine. By frothy, I mean foamy urine. You go pee and it's a lot of foam coming out from the urine. Yeah. Nausea, vomiting, just feeling weak, listless, having difficulty to control blood pressure. Some people might start seeing a reduction in the amount of, or in the volume of urine they make on a daily basis. Okay. People might start to see bloody urine in some cases. And so these are some of the symptoms that people would have that may point towards having kidney disease.
Okay, you said that may point, because while you were listing out the symptoms, I began to ask myself, and these are regular symptoms, symptoms that let me say that every typical, let's say, person from Nigeria, just has, and it ends up perhaps even finding out that it's typhoid, it's malaria, it's this or that. I mean, the color of your urine changes, or you feel weakness, like you said, or your leg swells. It's hardly ever attributed to kidney disease. So what then is your counsel regarding when we spot any of these symptoms in our bodies?
So some of them are non-specific. Nausea, vomiting. You could attribute it to anything. Difficult to control blood pressure. It could just be, it could be plain blood pressure that hasn't gone to the kidneys yet, but the kidneys play a huge role in blood pressure control. So when it's very high, you have to start thinking, what's going on? Do I need to check my kidneys? You need to rule out kidney disease when you start having very high blood pressure. Okay. But some symptoms are a little more specific than the others. Leg swelling. When you start having leg swelling and it is persistent, you better check your kidneys. You better check your heart. I hope no one is thinking typhoid at that point, because these are more specific symptoms. When you're peeing and you see that your pee turns red, especially for a male adult, not a female. Female red urine can be anything, could be menstruation. But still, if you're peeing and you're not menstruating, or you're peeing and it's remained red, then you better check your kidneys. For every male adult, if you're peeing and you're seeing blood in the urine, it is not benign. Something is going on that you need to check out. So some symptoms are more specific than the others.
Okay, thank you very much, doctor. So at this point, I'd like to ask, how do I keep my kidney safe? What do we do? What does one have to do to keep his or her kidney safe?
Very good. So when I was I'll start with the short story. When I was in Navy during my youth service, I took on a role. We formed a very I would say charity organization we called Health Relief Fund, and we would take up as a team and go to the villages and do health screening for people. Yeah. And it was shocking to find a number of young adults who had high blood pressure but did not know it. And high blood pressure has been called a silent killer, and diabetes as well. And so people have high blood pressure for so many years, they don't have any symptoms. They start to have something called end organ damage. And end organ damages could lead to significant cardiovascular disease, heart disease, can lead to kidney disease, can lead to cerebrovascular events, including stroke. And so what do you do to keep your kidneys safe? I think the very first thing, knowing that kidney disease does not have there's no cure. The best cure and the only cure for kidney disease is prevention, right? So what do you do to keep your kidneys safe is you do everything you can to prevent, the kidney disease onset to begin with. You check your blood pressures, you have a regular visit with your doctor. Yeah. You avoid indiscriminate, careless use of medications, which, by the way, in Nigeria, there is access to just about any medication. Knowing that these medications can impact your kidney function, you want to be very careful using them. So these are some of the things. But then overall, just living a healthy lifestyle. There's diets. We can have a conversation about diets. There is exercise. There is weight loss. Obviously, excessive weight and obesity impacts kidney function adversely. So these are some of the things you can do to keep your kidneys safe. So be mindful of the medications you're taking. Watch your weight. Engage in healthy lifestyle. If you smoke, I highly recommend that you stop smoking, even though I know it's easier said than done. But stopping smoking significantly, cardiovascular disease is a major risk factor for kidney disease. So you want to stop smoking. There are some of those things you want to do.
Okay. Finally, I saw a video recently on Instagram that talked about how to dissolve kidney stones. Some I'm trying to describe what I saw, but in some it has to do with, it's just a herbal remedy on how to dissolve kidney stones. So first of all, my question is, what are kidney stones, and is it possible to? Are you an advocate of trying to solve kidney problems via herbal means, herbal remedies, or is it purely white medicine?
Well, it's interesting. First of all, I can't speak to what this person knows about herbal medicine. Again, herbal medicine not being subjected to clinical trials and extensive study, it's really hard for someone to say, with a lot of conviction, that it works. And obviously, as we very well know, even in our medicine, in allopathic medicine, where we give medications, we know that for every medication we give, there are potential side effects. So I tell people to be mindful of that. Not knowing anything about the herbal medicine, I always tell people to be very careful, especially when they tell you things that sometimes seem unrealistic. When I say unrealistic, I mean dissolving a kidney. I don't know how you can dissolve a kidney. Dissolving a kidney stone. I don't know how you can dissolve a kidney stone when it's already formed. I don't know how you do that. By the way, kidney stones, when you have certain constituents in the urine, as a result of people maybe genetic predisposition, hydration status, people not drinking enough water, so many things can happen, or just the kidney is not flowing through the urinary tract down to the bladder and being peed out. Some of these things basically crystallize and form and come together to form a stone. It can be calcium. It can be calcium and phosphates coming together and crystallizing to eventually come together and form a stone. After it's gone past the kidneys, after it's gone from your blood, filtered into the kidneys, and it's making its way down into the bladder. Anywhere from the point where it's in the kidneys to where it's in the bladder can form stones. And I don't know what medications, right now in medicine, I don't know what medication would dissolve a stone, but we know things that we can do to prevent the stones from being formed. And when those stones are formed, there are things that we can do to break them down, not with medication, but really, there's a shockwave, something they call shockwave lithotripsy, which they can use to break the stones down, and they can actually go physically to take care of those stones and crush them. Okay. But as far as medication, I'm not sure.
Okay, thank you very much, Dr. DJ. This may be our first time having you on this show, but it's not going to be the last time. So you definitely cannot, I'm sure you've not exhausted all you have to say to us. There's going to be another session where you're going to exhaust all you have to say to us. But after this session, what follows next is a Q&A session with the community, where the community gets to ask you questions. We take questions from our YouTube comment section, Twitter comment section, Instagram comment sections. We put them all together, and then we'll have that live session where you get to we meet with the community and they ask you the right question, you get an answer. So I think by and by we'll be able to exhaust all those questions and get more knowledge from you. So once again, thanks for starting on our show.